George basically told me that he was confident there was no human to human transmission, and he was confident that there was no asymptomatic infection. So this was like SARS and MERS. If you got infected, you got sick. And if you got sick, you didn't really transmit it that well to human. Well, I was suspicious because in the first 27 cases, there were three clusters in families. And I didn't think that it was likely that the three members of the family all went by the same wet market space to get infected. Maybe one got infected and then came home and infected the other two. But I was assured there was no human to human transmission. Now, towards the end of the month of January, we had diagnosed in the United States in the first couple of weeks of February, I had diagnosed 14 people across the US that had this new COVID-19 virus. And of those 14 people, we identified 800 contacts about, and we evaluated those 800 contacts, and only two were infected. Now, we said, okay, this virus is like SARS and MERS. It's not very transmissible among humans. But how did we diagnose those two infected people? We asked them if they were sick or not, because George said there was no asymptomatic infection in China, which unfortunately wasn't true, we later learned. But if they were asymptomatic and not sick, we didn't test them. We only tested the people that were sick. If we tested the people, all 800 contacts, I guarantee you, we would have found there were a lot of people infected that had no symptoms. Because about 2 weeks later, this ship called the Diamond Princess was docking in Japan, and they had COVID on it, and they did invite CDC to come in and help them evaluate it. And when we got on that ship, we found out that over half the people on the ship were infected, and most of them were asymptomatic. So we knew asymptomatic infection was the rule, not the exception. So it meant our whole approach of identifying sick people and working around them was flawed.